Hello YouTube, this is Sam from Tiger Schooling, and in this session of the video we're going to talk about the axilla, and we're going to discover the apex, base and all the boundaries of axilla. We're going to talk about the contents of axilla in very much detail. So I want you to stay with me to have a good understanding of the axilla from 0 to 100% so you can get good marks in your exams. So let's get started. The axilla, or you can call armpit, is actually a pyramid-shaped space between the upper part of your arm and the side of your chest. So this armpit is called the axilla, which actually provides the passage to vessels and nerves from part of the neck to the upper limb. So important vessels, nerves pass from the neck towards the upper limb and provide upper limbs. So let's start with the apex. So apex is this area which I have highlighted in green, is actually, or you can say, the upper end. The axilla is, you can say, they have got four boundaries and a base and an apex. So this is an apex, the above side. This is a base, which I have written by B letter, A by apex, and I have drawn the boundaries. So let's talk about the boundaries. We have got the medial boundary on the medial side. This one I have denoted by M, which is this color coded. We have got the posterior boundary. We have got anterior boundary, that is anterior side of the body, and we have got the lateral boundary, which is on the humerus side, and we have got base and posterior, anterior, and all these four boundaries, and apex and base. They conclude about 6 sides. So let's start with the apex. So apex, or you can say upper end, is actually which is actually directed into root of the neck. So which the main vessels pass from the neck through this apex and enter the upper limb, or you can say the axilla. So apex is actually formed from the front. The apex area is formed from the front by the clavicle, behind by the upper border of the scapula, which may not be seen here, but it's very clear. This is the upper border of the scapula from behind, and from anterior, on the anterior side we have got the clavicle, but on the medial side we have got the outer border of first rib. 3 things. On the anterior side we have got the clavicle. Posterior side we have got the upper border of scapula. On the medial side we have got the outer border of first rib. This is regarding the apex. Now let's move to talk about the base. So base is actually formed by the anterior axillary fold and the posterior axillary fold. So you will be having, order is anterior and posterior. So your armpit have a skin like this one on the base side. So there is an anterior side and there is a posterior side. So the anterior axillary fold, which is actually formed by the lower border of pectoralis major muscle. Alright, let me mention the main muscles. So the base is formed by the the two folds. By two folds. There is the anterior axillary fold and the posterior axillary fold. So the anterior axillary fold is actually formed by the lower border of the pectoralis major muscle, and the posterior fold of the base is formed by the tendon of latissimus dorsi and the teres major muscle. So you can say tendon of latissimus dorsi plus teres major muscle, the base. All right. Now let's talk about the boundaries. We have got 1, 2, 3, 4 boundaries. Before talking the boundaries, I have to mention the muscles involved in muscles or areas formed in the forming the boundaries. And base we have got 2 muscles. We have got latissimus dorsi plus we have got teres major. In apex we have got no muscles, we only got bones, that is clavicle, scapulae, and on the first rib border of the medial side. So now the medial border, or you can say medial wall, is actually formed by the upper 4 or 5 ribs. 1, 2, 3, 4, 5. Upper 4 or sometimes 5 ribs, the medial border is formed by upper 4 or 5 ribs plus their intercostal spaces, or you can say upper 4 or 5 ribs plus their intercostal spaces, and there's a muscle called as serratus anterior. So serratus anterior We have got the upper 4 or 5 border of the upper border of the ribs, and we have got the intercostal and their intercostal space and a muscle known as the serratus anterior. And on the lateral side, this was the medial border and this is the lateral border. So the lateral border is formed by two main muscles and the bicipital groove of the humerus. So the two main muscles are the coracobrachialis plus the biceps, that's another muscle, and another groove which is on the humerus, which is called bicipital groove of the humerus. I'm not mentioning of the humerus, but you have to understand it's a bicipital groove of the humerus. But now let's talk about the anterior wall. So the anterior wall, anterior to all this, like this one, you have to see it from the front side, and on the back side, you have the posterior wall. I have just written P, so we cannot see it in two dimension, the posterior anterior, but you have to imagine as we go out of the page, it's the anterior side. So the anterior border, or you can say not the border, the anterior wall. So the anterior wall is actually formed by 3 main muscles. Which are these muscles? This includes the pectoralis, major muscle, the subclavius, which is actually attached to the clavicle, and the pectoralis minor. These 3 muscles form the anterior wall of the axilla. Coming to the posterior wall of the axilla, we have also got another 3 muscles. Like in the anterior wall, we have got 3 muscles. In the posterior wall, we have also got 3 muscles. But here is the concept. Look, in the posterior wall, we have got scapularis. We've got latissimus dorsi, and the last muscle is, you guessed it right, that's teres minor, right? On the base, we have got the teres major, but in here, we have got the teres minor muscle in the posterior wall. So we are done with the boundaries and the apex and base of the axilla. Now let's move forward. Now let's talk about the main contents of the axilla. So in main contents, we're going to discuss 4 things. We're going to discuss in detail about 2 things, especially the axillary artery, the axillary lymph nodes. But I have made a video on 2 other contents, that is the axillary veins and the brachial plexus, that are also the content of the axilla. But I have made a separate video of those lectures. You have to watch them in another videos. So now in this session, we are going to talk about these 2 main contents. So remember, we have got 4 contents of the axilla, which is axillary artery, axillary veins, brachial plexus, and number 4 is axillary lymph node. At first, we're going to talk about the axillary artery. To be honest, axillary artery is really simple. I don't know, people make it so much, so much hard and complicated. It's very easy. So you have to get it. You have to be with me in order to understand the axillary artery. So remember, from the left ventricle, do you remember what arises? From the left ventricle, we get the aorta. So from aorta, we have got, what is this? This is called brachiocephalic trunk. These are the branches of aorta. We have got subclavian arteries. So from the brachiocephalic trunk, we got subclavian artery. Get it? Aorta, brachiocephalic trunk, again divides. We have got a subclavian artery. And this subclavian artery, as it passes the first rib, its name is actually changed. It's not changed. Its name actually changed from subclavian to the axillary artery. So this axillary artery, so from here till the starting of the teres major muscle, its name is actually the axillary artery, and from there on, its name is changed to the brachial artery. So we are only concerned from here to here, and whatever the branches arising in between are in the area of the axillary artery. So all the branches arising here in between here are actually the part of the axillary artery. So get it again. Aorta, brachiocephalic trunk, so again divides and forms the subclavian artery, which passes the first rib, converting into the axillary artery. So we are clear with that? All right, now let's talk about, so axillary artery. Remember, axillary artery is actually I'm mentioning it, axillary artery is further divided into 3 sections. So, very easy. What? Axillary artery divided into 3 sections. There's a funny thing, like, and if we divide it into 3 sections on the basis of the pectoralis minor, on the perspective of the pectoralis minor, the branches arising before the pectoralis minor are the proximal branches. Other branches arising beneath the pectoralis minor, we call are the beneath branches. They are beneath them. And the last section, we have got the distal branches that are arising after the axillary artery is passing the pectoralis minor muscle. So here's a funny thing. The first branch, the first part of the axilla, which is in the proximal, the first section has got 1 branch. The second section, which is beneath the teres pectoralis minor muscle, has 2 branches, and the last part has 3 branches. Get it? First section has 1 branch. This is proximal. Beneath is the second section, which has got 2 branches. Like first has 1 branch, second is 2 branch, and third is 3 branch. So it's very easy to remember the branches. Like first has first branch, second has 2 branches, and third has 3 branches. Very easy, very simple. Now, as we talk about this one, so let me name those branches. So from the first branch, or you can say before the branches that of the axillary artery arising before the pectoralis minor, there's a 1 branch, and we call this branch as superior thoracic artery. What we call superior thoracic artery, which actually supply the first and second intercostal spaces. The first branch, first section, 1 branch, and that branch is called superior thoracic artery, which actually supply first and second intercostal spaces. So the second part of the axillary artery, or you can say the second section of the axillary artery, has actually 2 branches. So the first branch is this one, a bunch of branches called the lateral thoracic artery. And the second branch, which is also rising beneath it, called the thoracoacromial artery. So second part, 2 branches, lateral thoracic artery and the thoracoacromial artery. And let's move toward the third section, which is why there are 3 branches in the third section. That is the distal to the distal part of the axillary artery, and which is also distal to the teres, also distal to the pectoralis minor muscle, and has 3 branches. The first branch is we call it anterior circumflex humeral artery. This one. And the other one is called the posterior circumflex humeral artery. So these both are humeral arteries. They kind of go around the surgical neck of the humerus and anastomosis with each other. Another branch we have got here of the third section of the axillary artery is called as the subscapular artery. So third section has 3 branches. The last one is called subscapular artery. The 2 branches are over here called the anterior and posterior circumflex artery. So the subscapular artery is actually supplying 2 muscles, that is the supraspinatus muscle and the infraspinatus muscle. But the surgical these 2 branches, the anterior and the posterior circumflex humeral artery, are actually supplying the surgical neck of the humerus and muscles present there. So this is it regarding the axillary artery. Very easy, very simple. Three branches, how they're arising. I have explained it in an easy. Try it better to make it as easy as possible. Now let's move towards the axillary lymph nodes. What we call them? Axillary lymph nodes. So it's a group of nodes. So how you can say they are a group of nodes? So especially if somebody is asking you about the axillary lymph nodes, you'll be simply saying that there are these axillary lymph nodes are actually divided into 5 groups. All right. If anybody is going to argue and ask you how many axillary lymph nodes are there, you're going to simply say, I'm going to tell you a trick. A very easy trick to remember them all. But before that, I want you to remember this one. There are 5. The axillary lymph nodes are actually divided into 5 groups. The first group, very simple. Anterior group, or you can say pectoral group. Very easy. Anterior group, posterior group, or this one. Anterior group, posterior group, lateral group, central group, and the deltoid group. So 5 groups: anterior, posterior, lateral, deltoid, and central group. Very easy, very simple. So let's first talk about how they are going to drain, and then we're going to talk about little detail about each group. So remember this one: the anterior group and the lateral group and the posterior group all together are going to drain into the central group. All right, lateral, anterior, and posterior groups are all together going to drain into the central group. So central group is finally going to end into the apical group, and from the apical group it will move upward and it will drain into the subclavian lymphatic trunk. And finally, this subclavian lymphatic trunk is going to drain into either the thoracic duct if it is on the left side of the body. Remember, we have talked about the thoracic duct. We have a good video about the thoracic duct. You should check that out regarding the thoracic duct. So the subclavian lymph node trunk is going to end up into the thoracic duct if it's on the left side. But if it is on the right side, it is going to end up into the right lymphatic trunk. Very easy. We have got 5. These are extra groups: infraclavicular group and supratrochlear group. All right, these are extra group. They are not actually come in the axillary lymph nodes, but for the sake of understanding, I have made them here. So very simple. We have got 5 groups. That is the anterior, posterior, lateral, central, and deltoid group, which I haven't shown it here because that's a minor thing which brings the lymph nodes from the deltoid and other structure present or near it. So the lateral, posterior, anterior are going to drain into the central group. So central group with the infraclavicular is going to drain into the apical group. Apical group is going to drain into the subclavian lymph trunk, and it's finally going to drain into the right lymphatic trunk if it's present on the right side of the body. If it is on the left side, then we have got the thoracic duct. All right, so now let's talk in a little bit detail about each and every group of the lymphatic node. So let's first start with the anterior trunk. So the anterior trunk, or anterior group, is also called as pectoral group. Pectoral group. All right, so the pectoral group actually draws lymph from the anterior lateral aspect of abdominal wall. What does that mean, anterior aspect? You mean it's on the, you just figure out, you just get my words. Anterior on means anterior side, lateral means on your side. So it's on this lymph node, which is called anterior pectoral group, is actually going to draw lymph from your anterior lateral aspect of your abdominal wall, which is superior to the umbilicus. Remember, umbilicus, you remember what is umbilicus? Superior to the umbilicus, anterior side, and to the lateral, any lymph node is going to finally drain up into the anterior group. So again, we have talked about if it is superior to the level of umbilicus and the quadratus of the, and it's also going to take the lymph from the lateral quadrants of the breast, anterior pectoral group, or you can say pectoral group, or your anterior group of lymph nodes. And now talk about the posterior group. It's actually, it drains superior lymphatic vessels of back. You know, from the back side, if somebody's asking about the anterior side and the lateral side, anterior lateral side, you got anterior or pectoral group. From the posterior side, or the back. Simple. Posterior means back. So till the iliac crest, you know the iliac crest in your pelvis, on the area till that, from back above to downward till the iliac crest, it is going to drain into this posterior group. And again, this posterior and other group is called the lateral group, another group. So lateral group, or you can say infraclavicular group, which actually drains majority of lymphatic fluid from its upper limb. So upper limb, most of the lymphatics from the upper limb is actually going to drain into this one called, what would you call it, the lateral group of the axillary lymph node. And finally, we have got the central lymph node. We have talked about the central lymph node. All the lateral, posterior, and anterior are going to end up in the central lymph nodes. And the last group we have got the deltoid group, and which is not meant to be discussed in this lecture. So this is all about the 5 groups of axillary lymph nodes. And again, central is going to end up in the apical is going to end up in the subclavian lymphatic tract, and that is finally going to the right lymphatic tract, or if it's on the left side, it's going to end up in the thoracic duct. All right, so this is regarding these both. I have talked about axillary artery, which is the content of the axilla. We have talked about the lymphatic axillary lymph node, which is also the content of the axilla. And 2 things are remaining. That is the brachial plexus and axillary vein. I'm going to just give an overview of the axillary vein, because we have a really detailed video regarding the axillary vein. You should watch that out. You should watch that out. I'll leave a card above there. You can check that out. So now talk about the axillary. Just give a quick review of the axillary vein if you want to know. So the axillary vein is actually formed by 2 veins, that is the brachial vein and the basilic vein. So there was brachial vein and basilic. Brachial vein is the deep group of veins. Basilic is the superficial. So they both, when joined together, they form the axillary vein. So when axillary vein is alone, so this guy, when joins the cephalic vein, or you can say cephalic vein, they both join to cephalic vein and they form the subclavian vein. Very easy. So brachial veins and basilic vein form the axillary vein, and this axillary and cephalic vein again join together and drain into, or you can say join to form the subclavian vein. So this is all regarding the vein. About the brachial plexus, we had made a real detailed video regarding brachial plexus also. You should have to check it out. So in the contents of so let's just summarize it. In the contents of axilla, we have got this one, the axillary artery. Number 2, the axillary lymph nodes. Number 3, the brachial plexus. And number 4, we have got the axillary vein. All right. So we are probably done with our lecture. So this is it regarding today's lecture. I make sure to make another video regarding the other details topics. So please make sure to tell me, and I'll be there to explain it in detail for you. Thanks for watching. Keep visiting. Tags is cooling.